edition of Voices in Care, a Blessing Health System podcast. My name is Bo Beecraft, and joining me today is not necessarily a new face, but a new face in a new role. Jayme Connell is here. She is the new administrative director of the Blessing Foundation. Jayme, welcome.
Thank you.
And congratulations on your new position. This has got to be a pretty exciting time for you.
Absolutely. I'm very lucky.
Exciting and probably a little nerve-wracking.
The person before me did a wonderful job and laid a very lovely foundation, and it's big shoes to fill.
Yeah, she did, and we will get to that here momentarily, talking about her predecessor. But tell me a little bit about your journey to Blessing Health System.
Sure. I was in pharmaceutical sales for about 20 years, and when COVID hit, I had the opportunity to try something new. So not many people can say something good came out of COVID, but right. I can. I ended up here. I had a position at the Wellness Center, part-time, and then just kind of worked my way into a full-time role. I was at Be Well at Work for a little bit at the employer clinic, and then moved into organizational development.
So tell me how that transitions into your new role with the foundation.
Sure. Absolutely. I think the thing is, it's a lot of people skills. It's a lot of building those relationships and really following your word. And I think that you could probably have any degree and make this role fit. I'm very lucky that I have lived in this town for 50 years and raised my children here. My parents are here, my grandparents. And so, I know Quincy, and I think that's a big part of the job.
So talking about your prior history in pharmaceutical sales and things like that, you are interfacing day in and day out. Yes. Your job is basically client or public relations in a sense. So that's really a lot of what your role with the foundation is as well. So for those who don't know, tell me about the foundation. Why is it here? What purpose does it serve? How does it benefit our community and our patients?
Absolutely. So the Blessing Foundation, obviously the mission is to improve the health of our people. We are so blessed to have donors that make that a possibility to improve the health of our patients that we serve. Now, the whole concept of the foundation, it's not just one bucket of money. It is, and this is what I had to learn coming to this role.
Sure.
I thought, it's a foundation. There's just money given, and we go and we spend.
Yeah.
It's very specific purposes. So we have donors that have had such good experiences with our team at the hospital and our rural clinics in Illini and Hannibal that they want to give back. So those donors say, hey, I had really good hospice care. I want to give to hospice. Or I had a great experience at the Hannibal Cancer Center. I want to give back. And so that is what enables the foundation to exist.
So that you really did a great job of answering, whether or not this is, one big pool of money or if it's in buckets. So what is the benefit of that, especially, I guess I want to backtrack a little bit, but cost of living is kind of a huge concern for a lot of people right now. That's not mentioning if a medical event happens, right. If someone's health takes a turn for the worse and they're not prepared for that element of budgeting or things like that. How does this benefit people that, are facing a medical emergency or situation and they, it comes down to, can I afford to take care of this?
Oh, absolutely. And that's why we're here. That is why we're here. And the great thing is that I will tell you that I've learned that people will call the foundation and say, hey, I'm having this procedure done. I know I'm not going to be able to afford it. Can you help me? Well, yes, absolutely, but tell me more.
Sure.
So we have a very streamlined process on how we can support these people that are going through this medical, travesty, if you'll say, because you don't know when it's going to happen. It could happen right now. It could happen at midnight tonight. But working with our social workers, our inpatient care coordinators, outpatient care coordinators, they are really doing the work. They're peeling back the layers of the onion of what that patient is going through, and then filling out the appropriate paperwork, and then that gets funneled to me and my team. And then we go ahead and grant money is what we call it,
sure.
To help those people that are in need.
What can that look like in the form
Sure.
of, is it gift cards for gas? Is it
Sure.
covering a procedure or things like what
Absolutely.
does that entail?
Yep. So some things that we have had come across here as of late. I just took a phone call today. Somebody's transmission fell out of their car, going through treatments, going through cancer treatments. So this person is just like not bawling, but
Devastated.
They're devastated. They don't know where else to turn. They're doing all the right things, and then their transmission breaks on this 2019 vehicle, and it's going to be $4,000. So let's find out a little bit more, and just talking to the person, first of all, calming them down, letting them know there is something we can do for you, and let's uncover what that can look like. As far as gas money, that's a huge thing. gas is so expensive, traveling is expensive, maybe you don't even own a vehicle and you need a ride. That's what that can look like. So weekly, we have patients that are participating in treatments, cancer treatments, and we will give them weekly gas money. Now, that might look like $30, it might look like $60 for some, depending where you're located.
Sure.
So that's one option. The other option is that we can arrange for, maybe you like city transportation. We can arrange to have a pass purchased for you. We can also arrange to work with Integrity Transportation. They will build the foundation, and we are able to set up rides for that patient to and from treatments.
So basically, this is a very localized
Absolutely.
program and foundation. So the money that is donated to the foundation stays here in our
Absolutely,
community, which I think
yes.
is top of mind for a lot of people that are making these donations. They want to know where the money is going, how it's being spent, and how it's benefiting the community.
Can I add one thing to that?
Sure,
Not to interrupt
absolutely.
you, but that's the other thing I want to really hone in on is this is how we are different. Those donations that are made, they are 100% dedicated to patient care. That does not cover my salary. It does not cover my 2 assistants' salary. It is directly to patient care. So you can feel comfortable when I ask you in March, April to donate to our caring club, that money is going directly to our patients and to our own teammates.
Yeah. So what is, some people may seem hesitant or often are hesitant to ask for help or ask for a hand up in a time of need. What do you say to those patients, and how does the foundation benefit those that
Sure.
are a little hesitant to say, hey, I could use a hand?
Yeah, absolutely. That is the hardest thing, right? Who wants to say, I can't do this? You can do it. You're just going to do it a different way.
Sure.
You are going to reach out. We are going to listen. We are not judging. That's not our place. We are here just to listen and make your day a little bit better. Let's get you set up for success so the next time this comes around, you've been there, done that, and know how to handle it.
Yeah.
We hope it doesn't come around again.
Sure.
But we're there for you to get you from point A to point B.
Gotcha.
Another example I love is that we also have not only crisis care for our staff at the hospital, the health system. We help people, our own people that are patients of the health system.
Yeah.
But we also take care of our students that are in the Blessed Raymond College of Nursing and Health Sciences, and we have crisis funds for them. I wouldn't say I'm fortunate to have helped a few students, because I'm sure they don't think they're fortunate.
Yeah.
But we did have some students that one gal needed new tires on her car. They were flat. Another person lived in Tennessee, was going to school here, but also needed some work done on his vehicle to get himself back to Tennessee before Christmas. These students don't have the funds for these unexpected life occurrences. So I feel very lucky to be able to say, hey, we got you.
Yeah.
Don't panic about this. Go ace your final. Get done with your clinicals. Get ready for that next chapter, because it's going to be a lot more exciting than this tire
Right,
issue.
right.
We got you. And the great thing is that those donors have designated those funds specifically for those students.
Yeah.
So it's really amazing to watch how not only are they taking care at the end of the spectrum as a patient, they're taking care of you at the start of your journey as a student.
So from that perspective, kind of to piggyback off that a little bit, from both a personal and a professional perspective, how has it impacted you seeing the difference that these foundation dollars and grant money, as you mentioned, how's that impacted you?
It's very meaningful work. And I've been very fortunate for my career to have meaningful work, right? The pharmaceutical, it was a great position. Mm-hmm. It challenged me to put me outside my comfort zone. But it's been even better coming to the health system, because these are my people. These are people in my community that contribute to my community. And when I say community, I don't just mean Quincy. I mean Hannibal, Mount Sterling, Pittsfield. We're all a team. This is our health system. So it's made me really feel grateful for a team approach. Watching people in crisis is not that rewarding. It really makes you take a step back and think, there is nothing wrong with my life. Mm-hmm. There are people that have serious issues, and it just makes you really take that step back and talk a lot less and listen a lot more, and really use those creative thinking skills to see, okay, how can we best assist this person, not only today, but I want people to be successful down the road. Mm-hmm. So it's a very meaningful job.
Yeah. Speaking of down the road, and Awerkamp Dickson, your predecessor has now moved on down the road of retirement, and congratulations to her. Tell me a little bit about her passing that baton to you, what you learned from her, and how you hope to expand on the, for lack of a better term, foundation that she laid for you.
It's just phenomenal, the work that she did and the legacy she's left, it's really amazing. It's breathtaking. She was very, she left great notes. She was very detailed oriented, and that's what she really taught me, is that don't think about the tasks that you need to do next. Focus on the tasks that you're doing right now. Slow down. Sometimes you get busy doing things. I've had 2 kids and a husband that had a very demanding schedule, and you just kind of get in that mode where you go, and it'll be fine. But this position allows you to slow down, look at what you're doing right now, who you are impacting right now, and who else can you bring into the circle to support the person that you're helping.
Yeah.
So those are the things that Ann has really taught me.
So what are some of you mentioned kind of that circle of caregiving, and who are some of the other people that can typically be involved? What does that look like in certain situations?
This is what was so mind-blowing to me, is all the people that are behind the scenes. So, first of all, I wanted to definitely give a shout out to Pam Frerick. She's lovely and lovely doesn't seem to cover it, but she is really the rock of this whole thing.
Yeah.
She can answer things like that, and she's so great. And then Brittany Bracey has joined our team. She is catching on like no other.
Yeah.
And she's got an infectious smile and a lot of energy, so that's fantastic. So they will always be involved, because it's not just me doing the work, we're a team. And sometimes maybe I'm looking at something from one angle and they might pick up on something I missed. And so then we might be able to allocate it to a different fund. So that's one part of the picture. The other part of the picture that definitely does not get enough kudos is our inpatient care coordinators, outpatient care coordinators, the nurse navigators, the social workers, the clinical team, it's been amazing to watch these ladies do the work. I will tell you that I have been interacting with Rosie Hahn, and I feel like she's my new best friend. She is a wonderful person. She works so hard for these patients, and I have a badge of honor that I wear, knowing that I work for this health system because of the great people that are supporting our patients. They are really taking the time to dig deep, and I know it's their job, right? But I didn't know that until I got here. But I feel even more confident today saying to my family, if you have an issue or a friend, if you have something, Blessing is going to give you the best care. But they're not just going to treat your illness. They're going to treat what else is going on.
Yeah.
You've got that house payment that's coming up that there's no way that you're going to make that. You've got an insurance payment. You need me to pay your electric bill this month. So that's been really amazing, just to watch this whole team of people come together to support one patient.
Yeah, and you talk about the internal team, but what about the people outside, the folks that are making these donations, things like that? What has that experience been like for you to watch?
It's been wonderful. We have what's called our annual holiday appeal, and that's a mailing that we send out, and just saying, hey, this is what we've done this year in the foundation. Would you consider giving? And this year we have sent out 6,000 mailers, and we're already up 24% from last year with people just making donations. And it's because they had a good experience here and they've seen the work we're doing. And when I say we, I don't mean the foundation. I mean the people inside the walls of the health system, that they're doing the work. So congrats to them.
Yeah.
But the donors are it's amazing to listen to the stories, and it's important to them. And I think that's with all the organizations in town. We talk about what the foundation can do for the patient, but we always encourage our patients to work with the other area agencies as well. United Way does a great job. We are the Salvation Army, Horizons. We are very blessed to have this teamwork of people, and we all support each other from an organizational standpoint.
As far as donations are concerned, what can a donation look like? Is it as simple as somebody coming in and saying, hey, here's a little extra money, do with it what you will? Can folks set up a recurring contribution, wills, trusts, estates, things like that? What do donations look like for the foundation?
Our biggest asset are our 4,000 employees. We have what's called the Caring Club, and that's when we encourage you to give. You can give a one-time gift. You can give every pay period, and it can be as little as $1, or you can make a $250 donation, right? The sky is the limit.
Sure.
So that's going to be one avenue, and that's really what supports our Employee Crisis Fund, or other patients that don't have a specific fund to fall back on. So that is one way. Another way is for when people pass. That's how we've gotten the 50 scholarships we have at Blessing Riemann College of Nursing and Health Sciences. People had a great experience, or they went to school there, and they want to continue their legacy. We just had someone that retired recently from the college come in, said, hey, can I come in and talk to you? I want to set up a scholarship. She was very specific in what she wanted her scholarship to be for.
Yeah.
And that was amazing. She made her donation. It will sit there for a year. It's endowed. It will grow. and it will never die. It will be
That's
a continuous scholarship.
Yeah.
And it's fascinating. You can definitely come to the office. We had someone come in. He worked for a business that supports, I work out of the Blessing Business Center. His business he's out there weekly. And he came in right before Christmas and said, you took care of me when my wife and I were struggling. My wife works here, and I want to go ahead and make a donation for Christmas. And so he had cash and handed it over to us.
Yeah.
So we take it. Please come in and say hi. I would love to meet people. We do that. You're always welcome to come in. You can send us a check. You can call me on the phone. I take a credit card. If you don't want to punch in the numbers, I'll punch them in for you.
Anything else we should know about what the foundation can do for our patients or the community, or
Sure.
things that you're looking forward to accomplishing as you take over the role here?
Absolutely. I will tell you one hidden gem that I also have figured out is the Teresa Adams House. The foundation does support that. We ran the capital campaign, and we had 99% completion of collecting those donations. So that's also speaks volumes for this community to support a campaign like that to almost 100%.
Yeah.
So that's one hidden gem. The other thing I learned about the Teresa Adams House is that it's not just for patients of Blessing Health System. It supports our community partners. It supports Chaddock transitions. If you have someone coming in town for a funeral, it's a place to stay, and it's beautiful, it's clean, it's very peaceful. And so that's been another, really a gem of this position that I've learned about is the Teresa Adams House.
Excellent.
Yep.
Well, thank you, and congratulations on the new role.
Thank you.
And we're excited to see what comes as we move forward.
Absolutely.
So, Jayme Connell with the Blessing Foundation. That's going to wrap it up for another edition of Voices in Care, a Blessing Health System podcast. I'm Bo B. Kraft, and we will see you next time.